Nurse. Letter A, nursing grades. Nurses working in a hospital have the following grades. A student nurse, a nurse who is still in training, a staff nurse, a nurse who has completed the training course, church nurse, a more explainers, nurse who is in charge of or responsible for a ward or department. Nurse manager, a nurse who is in charge of several wards. Note: the old term sister is still sometimes used for a female change nurse. A female nurse manager may be called matron. Dr. James is talking to Sister Watkins. Letter B, supports working. The clinical supports worker who has done a short course and obtained basic qualifications, and the nursing auxiliary who is usually unqualified but assistant nursing staff. There are many also the ward clerks who duties include making sure patients' notes and information are up to date and answering the telephone. Specialization. Like doctors, nurse can specialize. A midwife has specialized from the beginning by doing a course in midwifery. The management of pregnancy and childbirth. District nurse visit patients in their homes. Health visitors also work in the community, giving advance on the promotion of health and the prevention of illness. Letter D, the nurse role. The nurse role has changed considerably in recent years. In addition to general patient care, checking temperatures and rates and blood pressures, changing dressings, giving injections, and removing sutures. Nurse now do some of the things previously reserve for doctors, search prescribing drugs, and ordering laboratory tests, more responsibility for nurse in plating as the following article demonstrates. Nurse carry out surgery in effort cut patient waiting list. Nurses in Scotland train perform minor surgery have entered to the operating theatre for the first time in an effort to cut patient waiting times. 5 nurses who has faced a new course at Glasgow Caledonian University are now qualified to carry out such procedures as the removal of small lesions, bleeding, molds, and cysts. The verbs perform and carry out are used with all types of procedures. They are often used in the passive form. Perform, carry out an examination, an operation, a procedure, an experiment, a test, a biopsy. The procedure was performed, carried out by a nurse. Exercise 7.1. Complete the sentence. Look at A, B, and C opposite to help you. 1. Someone who specializes in delivering babies in a midwife. 2. Someone who is qualified to assistant nurse is a clinical support worker. Someone who is not qualified but is able to assist nurses in a nursing auxiliary. 4. A nurse who has qualified is a staff nurse. 5. A nurse who specializes in health promotion is a health visitor. 6. A nurse who looks after a ward is a change nurse. 7. A nurse who works in the community is a district nurse. 8. Someone who answers the ward telephone is a ward clerk. Exercise 7.2. Make word combination using a word of phrase from each box. Look at the opposite to help you. Carry out a procedure. Change a dressing. Check a temperature, give an injection, remove and sutures. Exercise 7.3. Complete the sentence with the correct grammatical form of perform. An isotope brain scan is plainest and easy to perform. 2. Biopsy of the pancreas was performed to March. 3. Is the patient's condition deteriorates, a laparotomy should be performed. The last if a diagnosis of meaning is suspect, a lumbar puncture must be performed. Last year, we performed a randomized double-blind study. Exercise 7.4. Complete the sentences with the correct grammatical form of carry out. 1. I now intend to carry out a large study. 2. Unfortunately, few properly controlled trials have been carried out. 3. A number of studies have been carried out frankly to look at this question. 4. A right hemicolectomy was carried out and the patient made a full recovery. 5. The procedure can be carried out in the emergency department. Thank you.